Good day. My name is Claudette Pretorius and I'm from the School of Computer Science at University College Dublin. Today I'll be presenting our paper, Searching for Mental Health, a mixed method study into young people's online help seeking. My co-authors on this paper are Dr. David Coyle and Darragh McCashin, also from UCD, and Kavanagh from Jigsaw Youth Mental Health Services. Poor mental health continues to be an important issue when considering the challenges facing young people. The prevalence and etiology of mental illness is of great concern at a global level. It's been suggested that 25% of young people aged between 12 and 25 will experience a mental illness such as a depressive or an anxiety disorder. Young people face unique challenges as they make the transition into adulthood, including concerns about body image, education, and transitioning into independent living. Help seeking has been found to be an important protective factor and is associated with improved health outcomes. Whilst poor mental health is increasing, help-seeking behaviours remain low. The availability of technology and the accessibility of the internet have created more sources of help and information to become available, which is changing the nature of help-seeking. Offline resources remain an important source of help to young people. However, it's now possible for them to engage in help-seeking both online and offline. Two theories were applied throughout this paper: Rickwood's help-seeking model and self-determination theory. Rickwood's help-seeking model was a process model that was specifically developed for young people. It recognizes the internal process that's necessary for young people to seek help and to move from it being an intention to a behavior. The process is initiated when the young person becomes aware that there are symptoms or difficulties that are causing them concern. They then make the appraisal whether these concerns might require intervention. The next step requires the young person to have the skills or the ability to express their difficulty in a way that is understandable to others. The third step in the process requires that there be sources of help available that suit that young person's needs. And the final step requires the young person to be willing to approach these sources of help and disclose their concerns. There are factors at each of these steps that can either facilitate or hinder the process. For example, if a young person has low levels of mental health literacy, they might not be able to appraise their difficulties correctly and will not move forward with the process. The internet and technology provide the opportunity to intervene at each of these steps in order to facilitate the process. Online resources can improve mental health literacy, decrease stigma through providing anonymity, and can offer additional pathways through which to access mental health services. The second theory applied in this paper is self-determination theory, based on the work of Ryan and Naoise. Self-determination theory, or SDT, is a macro theory of motivation and well-being. It is based on the premise that each person has an innate drive towards growth. This theory also states that each person has three basic psychological needs: autonomy, competence, and relatedness, all three of which play a role in a person's functioning and psychological growth. It asserts that goal pursuits can be understood through the satisfaction of these three needs, and that facilitators and barriers to a behavior can be understood in terms of the fulfillment of these needs. SDT as a framework easily lends itself to the design of technology. Self-determination theory is a useful framework for us to use to examine the factors that might influence a young person's online help seeking for mental health concerns. This paper presents the results from two studies conducted in the Republic of Ireland: a large-scale online survey and a co-design study. The results from the online survey will be presented first, as findings from the survey informed the design of the co-design study. The survey consisted of both open and closed questions and addressed young people's technology use, areas of personal and emotional concern, their preferred online resources, credibility, and barriers and facilitators to online help seeking. The full quantitative result can be found on the Journal for Medical Internet Research, and it is referenced in the paper. This presentation will focus on the qualitative findings from the study, as it provides the context for the co-design study. A total of 1,308 participants completed the survey. 78.5% of which were female. The mean age of the population was 20.68, with the minimum and maximum age range of 18 and 25 respectively. The survey had good national coverage, and 67% of the population of the sample reported living in a city or town. Majority of the sample reported that they were currently at an undergraduate level of education. When asked about the barriers and facilitators to online help seeking, participants highlighted that anonymity and confidentiality played an important role in their motivation to use the internet for help seeking. It was also really appealing to them that they could connect with others who had had similar experiences to themselves. This could be done through reading personal stories or interacting on forums. Some important barriers were concerns about credibility and not being sure whether the information they found online was reliable. Another key barrier was frustration with information and resources that they found to be too general or too repetitive and was not specifically tailored to their needs. Qualitative questions focusing on their online help-seeking preferences revealed 3 key groupings. The first one is that of the information seeker. The information seeker is an independent help seeker who's going online to browse information regarding their mental health concern and doesn't want the interference or intervention of another person, be it online or offline. They are just looking for a confidential experience where they can access trustworthy and easy-to-read information. The person-centered help seeker, on the other hand, is looking for an affirming and empathetic experience. They would like to validate their own experiences and would appreciate the help or assistance of an online guide. This is often due to feelings of uncertainty and not quite being sure what to search for. Finally, there's those young people who are going online who are in crisis. They are looking to connect with another person because they are in severe distress and require immediate assistance. Using all of the findings from the survey, 4 broad categories of design features were apparent. Content needs to cater for a broad spectrum of help-seeking needs. There needs to be both formal and informal information. Formal information in the form of facts, informed by reliable resources, and informal content created by young people for young people. There need to be interactive features. Young people expressed the need to interact and engage with the content they find online. They suggested that this could be done through the comment section on the bottom of information pages, with the ability to upvote certain comments, much like you would see on platforms such as Reddit. Depending on the help seeker, the need to connect with another person online was also highlighted. This could be either a peer or a professional, depending on the young person. Thirdly, it needs to support credibility. Uncertainty about credibility featured throughout the survey, and it's likely to be a barrier to future help seeking. Helping young people to assign credibility should be an important focus of online resources. They can do this by including references to scientific research, hyperlinking to other relevant online sources, or by indicating partnerships with government or with schools or colleges. And lastly, we need to acknowledge that different help seekers take different pathways. The survey highlighted that different help seekers have different goals when they seek help online. Currently, most resources follow a clinical model and focus on symptoms and diagnoses. This often pathologizes a normal response to everyday events and stresses. This could potentially have a really negative effect on future help seeking. Next, I'll present the findings from the co-design study. The co-design study consisted of 4 workshops run over 3 weeks. There was a total of 35 participants, with 20 female and 15 male participants. Participants were either from a vocational college or the youth advisory panel from a local youth mental health services charity. As mental health concerns are often a sensitive subject, and the co-design workshops included group work, 3 personas were used to guide activities in the workshops. Data from the survey was used to develop these empirically derived personas. Each persona characterized one of 3 goals: to find information, to connect with others, or to find immediate help in times of crisis. The workshops consisted of 4 distinct phases. persona immersion using empathy maps, mapping the online help-seeking journey, brainstorming features for an online mental health resource, and finally, the design of the ideal online experience for their persona. The overall dataset clustered into 4 themes that described important design needs for young people throughout the help-seeking journey. The first theme was that of chat and relatedness. Participants expressed a clear wish for relatedness. This could be achieved through different formats, including chat with peers and professionals, community forums, or social media. What was clear is that opportunities for relatedness need to be available 24/7 and not just during office hours. The second theme was around information and competence. The second theme was regarding the need for information regarding mental health resources. However, the amount and the complexity of information often impacted upon young people's sense of competence. Many groups expressed a need for traditional information pages and FAQs, but also wanted a diverse set of formats, including videos, podcasts, and personal stories. Thirdly, the personalisation of resources and autonomy was highlighted. There was a strong preference for online resources that could provide both content and features that were personalised to young people. When they browsed pages, they often expressed a need for tools to find information and resources that would suit their preference for the persona. The design suggested that this could be done through the use of quizzes, questionnaires, or other psychometric tools. The last theme was around immediacy. Participants emphasized that the need for help and resources that could be acted upon immediately and relieve distress in the moment was really important. This could be done through practical activities such as guided meditations or breathing exercises. Other suggestions included daily challenges and inspirational quotes. When considering the findings from both studies, consistent themes were present. These themes can be understood through the following 4 key design recommendations. The first recommendation is to provide opportunities for connectedness. Online resources need to create opportunities for young people to connect with both professionals and peers through different mediums. The option to remain anonymous is important here. Secondly, we need to provide credible and accessible information. Information that was tailored to young people or that's presented incorrectly often posed as threats to young people's competence and could deter the help-seeking process. Information should be presented in different formats that cater for different levels of mental health literacy and for different help-seeking goals. The third recommendation is to provide personalisation but respect anonymity simultaneously. Young people find it difficult to find the appropriate content relative to their need. There's an abundance of choice, and search results do not often speak to their help-seeking goals. We need to make it easier for young people to tailor the information and resources that they're finding and using. And finally, we need to provide just-in-time support options. Online mental health resources have the opportunity to play an important role in young people's help-seeking and in making sure that they get the right help at the right time. Online resources have to have options available for both short and long-term activities that can relieve distress in the moment, but also in the long term. I'd like to thank you for taking the time to listen to our presentation and for reading our paper. I'd also really like to thank all of the young people who participated in our studies and who gave up of their own time to share their opinions with us. If you'd like further information, please do get in touch either through email or Twitter.